My name's Anissa. This is my full head to toe assessment. So first I would perform hand hygiene and provide privacy. Then I'm going to come in and say, knock, knock, knock. Hi, my name's Anissa. I'm going to be your nurse today. I'm just going to do a full head to toe assessment on you. It should take about 20 minutes. Can you verify your name and date of birth for me?
Ryan Lively, 6/1/1993.
Okay, and what are you coming in for today?
Just a checkup.
Okay, do you know what day of the week it is?
Yes, it's Wednesday.
And do you know where you are?
Yeah, I'm at the doctor's office.
Okay, and are you currently in any pain?
Nope.
Or do you have any allergies?
Nope.
Okay, so my patient is alert and oriented ×4. He has no signs of acute distress. He's sitting upright. His facial expression is smiling. His mood is happy, and his speech is precise and clear. So now I'm going to, I would move on to vitals. So I'm going to do blood pressure, pulse, respirations, temperature, and pulse or oxygen saturation. Then I'm going to go on to assess his skin. So just looking, his skin tone is appropriate for race and ethnicity. Feeling it's warm and soft and intact. He has no signs of any lesions, no wounds, and no incisions. Now I'm going to assess his fingernails. So his fingernails, they're pink. They have a capillary refill of less than 2 seconds, and there's no clubbing noted. So next I'm going to go on to assess his head. So just looking, there's no signs of lesions, no infestations noted. Also, can you smile? Okay, can you frown? Raise your eyebrows. All right, so let me know. I need you to close your eyes and tell me when you can feel touch.
No.
Okay, and can you shrug your shoulders for me? You can open your eyes. So cranial nerve 5, which is trigeminal, cranial nerve 7, which is facial, and cranial nerve 11, which is accessory, are all intact. So I'm going to go on to his eyes. Just looking, there's no redness, no drainage, no discharge noted. I'm going to pull down. You can look up. So the conjunctiva is pink, the sclera is white. Conjunctiva is pink and moist, sclera is white. Now I'm going to use my pen light and just look straight ahead for me. Okay, so pupils are 3 millimeters. They're equal, round, reactive to light, and follow my pen light. And to accommodation. Now follow it again. This is going to be the cardinal field of gaze. Okay, so cranial nerve 3, which is ocular motor, cranial nerve 4, which is trochlear, and cranial nerve 6, abducens, are all intact. Now I'm going to go on to his nose. Can you look up for me? Okay, so just looking, nose is symmetrical. There's no deformities, no inflammation, no drainage noted. Okay, you can look down again and then just blow out one side and the other side. Okay, so he has bilateral patency. Now I'm going to do the ears. So I'm just going to inspect his external auditory meatus. There's no sign of drainage. I'm going to do the other side. No sign of drainage on this side either. And based off the whisper test, cranial nerve 8, which is the acoustic, is intact. Now I'm going to go on to his mouth and throat. So just open your mouth for me. So just looking, his tongue, lips, and gums are all pink, moist, and intact. Can you say ah?
Ah.
And can you stick your tongue out and move it like side to side? Okay. So cranial nerve 9, which is glossopharyngeal, cranial nerve 10, which is vagus, and cranial nerve 12, hypoglossal, are all intact. Now I'm going to go on to the respiratory system. So I'm going to put this down. Okay. So just looking, upon inspection, there's no accessory muscle use noted in his anterior chest. Now I'm going to listen with my stethoscope with the diaphragm side, okay, to the lung sounds. Okay, so I'm going to go right upper, left upper, right middle, left lower, and right lower. Okay, now I'm going to move to the back side. We're gonna do right upper. Left upper, right upper, right lower, and left lower. So all lung sounds are clear. Now I'm going to do the cardiovascular system. So I'm going to palpate his carotid arteries one at a time. Okay. And that has regular rate and rhythm 2+ bilaterally. Next, if we were in a hospital setting, he would be in a bed, so I would elevate the head of the bed to a 45-degree angle, have him turn his head to the left, and there's no JVD noted. Now I'm going to auscultate the cardiac areas. First I'm going to do with my diaphragm, and then I'll switch to the bell. Okay. So first is aortic, which is the second intercostal right sternal border. Pulmonic, second intercostal left sternal border. Erb's point, which is third intercostal left sternal border. Tricuspid, fifth intercostal left sternal border. And then the mitral, which is also the apical pulse, is the fifth intercostal midclavicular line. Now I'm going to switch to the bell. Do the same thing. So aortic, pulmonic, Erb's point, tricuspid, and mitral. All heart sounds are clear and no murmurs were noted. Now I'm going to go on to the abdomen. So just looking at the abdomen, if we were in a hospital setting again, he'd be in a gown, so I'd be able to look at the skin and everything. But just looking at symmetrical, abdomen is round. So now I'm going to listen first with my diaphragm side to the bowel sounds. Okay, so we're gonna go right lower, right upper, left upper, and left lower. And all bowel sounds are normal active. So now I'm going to palpate in the same direction. So right lower, right upper, left upper, and left lower. You don't feel any pain, right? Okay, so no distension and no tenderness is noted. Now I am going to do the musculoskeletal system. So I'm gonna have you stand up in a minute. But first I'm just gonna look at the elbows. So elbows are symmetric bilateral and wrists are symmetric bilaterally. Okay, so now I want you to do pronation, supination. Okay, so this is also flexion of the elbows. Can you do extension? Down by your sides and then back behind you. And that's hyperextension. So he has full range of motion bilaterally in his elbows. Okay, now with your wrists, you're gonna do flexion, extension, and hyperextension. Okay, so he's got full range of motion in his wrists as well. Okay, hold your arms out for me. Okay, don't let me push down on him, okay? All right, and don't let me push up. Okay, so he has a muscle strength of 5. Now I'm going to check his knees. So just looking. They're symmetrical bilaterally. Ankles are symmetrical bilaterally. I'm gonna have you stand up. Okay, so I need you to do flexion, extension, flexion, and extension. Okay, so both knees have full range of motion. You can sit back down for this part. Now for your ankles, I need you to do plantar flex, dorsiflex. Same on the other side, plantar, dorsi. Okay, and then I need you to do eversion, roll it out. Other side, eversion, and then inversion, roll it in. Other side in. Okay, so he has full range of motion in his ankles as well. And then same thing, so I'm going to push down, try not to let me push. Okay, and then I'm going to do up. Okay, so lower extremities have muscle strength of 5. I'm gonna have you stand for me. Okay, take like 3 steps toward me. Okay, and turn around and go the other way. So he has an even, steady gait. You can sit back down for me. So I am gonna use my one miss because I forgot to do, I'm gonna palpate your radial pulses. So I'm gonna do this side. This side. Okay, so he has regular rate and rhythm, 2+ bilaterally there. And then the pedal pulses. Regular rate and rhythm, 2+ bilaterally there. And then the posterior tibialis pulse. And he's got regular rate and rhythm in those as well. Okay, so the last thing we have to do is sensory function. So I'm gonna have you close your eyes and then I want you to tell me when you feel dull or sharp, okay?
Dull. Sharp. Sharp. Dull.
Okay. Now I'm gonna do it on your legs.
Sharp. Dull. Dull. Sharp.
Okay. So he has full sensory in his lower and upper extremities. This concludes my assessment for today. Again, are you in any pain?
Nope.
Okay, so I would put the bed in the lowest position, side rails up, locked. I put the call light within reach. I'm gonna thank my patient, thank you, and I'm gonna perform hand hygiene.